Hi, Paul Sackis, Good News Planet. We're going to talk about April being National Parkinson's Disease Awareness Month. And we have a wonderful doctor with us, Dr. Joohi Shahed. Ha-Men-Is Sha-head. I don't know if did I mess up your name? You can tell me straight out.
Sure. Dr. Shahed is fine.
and a real gentleman, an honorable man, Jeff. Hi, Jeff. How are you?
Good, thank you.
I say that honorable because you're willing and open to come and speak with us about Parkinson, and I might even be a little nervous because after 5,000 interviews, but my mom had Parkinson's disease, and so I've lived through it. I did the Brain Series also. We talked about people with Parkinson's disease, but we have today good news because there's some new advances in technology that can help people with Parkinson's disease. So, doctor, well, why don't you tell us first, if you don't mind, what is Parkinson's disease?
Yeah, sure. Parkinson's disease is a brain disorder. It's a neurologic condition that unfortunately can progress over time. And the main symptoms that it causes for patients are related to movement. So people will often experience things like tremor, stiffness of their muscles, slowness of their movements, and difficulty with walking and balance. And the real challenge here is that these symptoms can start to affect their ability to perform their day-to-day functions. So things as simple as maybe getting up and walking around the house, maybe getting dressed in the morning, or even trying to sit down and enjoy a meal. These are all activities that can become increasingly difficult over time. And so Jeff and I are happy to be here joining forces with Medtronic today to raise awareness about this condition and to talk about some of the treatments that are available. And the good news is, although there isn't a cure for Parkinson's disease, there are a number of different treatments, both medications as well as some surgical options that can help control those symptoms, but also improve quality of life for patients living with this disease.
Jeff, how did this all start for you?
Well, I was a dentist for 40 plus years, and I was very happy. And then I got the diagnosis. I had to, the medications that they gave me did not work, and I had to retire. The stiffness and the tremors were just getting to me, and I decided to look for treatment, and I did my research, and I found Dr. Shahed.
Now, how does somebody diagnose that you have Parkinson's disease? How does somebody figure that out?
Yeah, so a common set of symptoms that people experience maybe would start out with a little bit of tremor, some difficulty with coordination and dexterity and maybe their arm, and eventually they can also experience the stiffness, the slowness of movements, and the difficulty with balance. So it's really kind of a examination and history taking that really kind of clues us in that somebody might be experiencing features of Parkinson's disease, and through a detailed examination and history taking, then we really can confirm our impressions that somebody is dealing with this particular condition.
And does it come from the brain or from the back? I have pain coming down my leg. I'm going for an MRI on Thursday. And I don't know, is that a beginning symptom? And I'm getting up and I can't walk too well?
Yeah,
so a little problem?
Yeah, the walking symptoms in Parkinson's are quite specific. Usually people are slowing down with their walking, they're taking shorter steps, maybe they're dragging their feet a little bit, and it's not really related to things like back pain, although back pain might be common in people with Parkinson's just because it's a common symptom that people have. But this is really a difficulty with walking that originates in the brain, and it has to do most of the time with changes in the brain that are associated with loss of the cells in the brain that make a chemical called dopamine. And when you lose that dopamine, that's when these symptoms happen.
Okay. And so now talking about dopamine, is there a way, or somehow I recollect PET scans somehow to check out things like this. Is that so?
Yeah, so there's actually a scan called a DAT scan. It's not a PET scan, it's a little bit different, but what is done is that it's a way to kind of image the dopamine nerve terminals that are in the brain of a patient. And so if you do this DAT scan and it's completely normal, then we don't think that people have Parkinson's disease, because that would indicate that the amount of dopamine in the brain is normal. But if the DAT scan is not normal, then they might have a condition compatible with Parkinson's disease. It doesn't actually diagnose Parkinson's itself, but it can certainly point us in that direction.
Okay. Jeff, for you, what have been some of your challenges as a result of this?
Well, the challenges have been I could not bring my wife coffee in the morning, which I'd love to do. And then afterwards, it was great. I was able to do it, and she's appreciative of that, and I'm appreciative of that. I was afterwards, I was able to play with my 4 grandchildren and play golf, which I wasn't able to do beforehand. So it's just been fantastic.
So we're going to talk about, I think it's DBS, deep brain stimulation. Okay, that sounds wonderful. What does that mean?
Yeah, so that's a surgical treatment for Parkinson's disease, so deep brain stimulation or DBS, and it is usually something that we recommend to our patients once they have been taking medications for a period of time, but those medicines are no longer really giving the patient the degree of symptom relief that they need in order to get through their day. And the way that it works is really kind of like a pacemaker. So patients have a battery that's implanted into their chest. The battery is connected to wires that are placed into the deep brain regions that are responsible for controlling movement. And we program the device to deliver a small electrical current, and once that electrical current reaches those deep brain structures, it can really kind of block or override the signals that are associated with those symptoms. So the things like tremor, stiffness, slowness, we can really kind of see them, and it's really amazing to see this happen, that once you turn that stimulation on, it just sort of melts these symptoms away, and Jeff was really no exception to that, and I think that's what he was referring to when he talked about being able to do some of these things. But I do want to mention that although Jeff had a great response to this treatment, it's not right for everyone, and so people who are interested in DBS really should talk to their doctor about whether they're a good candidate and to understand the risks and the benefits of the procedure.
So Jeff, how long, and yay Jeff, and yay you, doctor, and yay Medtronics. Medtronics is a wonderful company, socially responsible, good corporate citizen as well. I know them, and that's really super. How do you feel now, Jeff? So, and how long have you had the DBS treatment?
Well, I've just had it since November. I feel great. The tremor is gone, as you could see. I'm just feeling fantastic, and I'm thankful for everybody who's done work with me.
And Jeff, you said things like your energy levels were improved, you're able to get out and do things that you weren't able to do before. Yeah, it's been really great to see.
So the decision on whether to do this or not, what are the factors, doctor?
Yeah, no, that's a really good question. As I mentioned before, it's usually the type of treatment that we offer once patients have been taking medications. And one of the challenges in the long term with managing Parkinson's disease with medications is that people will often start to develop the wearing off effect from the medications, or they might experience involuntary movements as a consequence of taking the medications. And really, it's often when those symptoms are present that we really offer the deep brain stimulation. We look for a variety of different things to kind of make sure that people are a good candidate. I'll say the other reason that we will offer deep brain stimulation is when people, like in Jeff's case, had tremor that really just was interfering with their daily functions and really did not respond to a medication. So those are kind of the main things that we're looking for, and then, like I said, a variety of other assessments that we ask patients to do to find out if they're good candidates.
Well, and you're with Mount Sinai, Icahn School of Medicine at Mount Sinai. I will say Mount Sinai helped save my life also for a colon situation in my life.
Yeah, fantastic institution.
A great hospital. Neurologist. Why are you a neurologist?
Yes. So I'm a neurologist and a movement disorder specialist, which means that I have specialty training in the evaluation and management of people with movement disorders such as Parkinson's disease.
What I meant is, why did you become a neurologist?
Oh, why did I become a neurologist? Oh, no, that's a good question, too. So, I think as Jeff has shown to you, I mean, these are disorders that can really kind of affect patients in their day-to-day activities, and it's really quite rewarding to be able to offer them treatments that are helpful, and that's really also one of the main reasons that I've chosen to specialize in deep brain stimulation, because it can really be so impactful for patients with this condition.
And Jeff, did I hear it correctly? You were a dentist did you say dentist for 42 years? Is that what I heard?
Yes, I was, and I was forced to retire because of this. Had I known about DBS sooner, things may have changed, but that's what happened.
What did you like about dentistry?
Dentistry was, I could interact with patients, forgetting about the digital manifestations of it, but I loved interacting with my patients.
You two are wonderful. Thank you very much for sharing the good news. Is there a website, or where can people go to learn a little more?
Absolutely. There's a great website called discoverdbs.com. I encourage everyone to take a look at that website, both for more information about Parkinson's disease as well as about deep brain stimulation, and also to get connected with a movement disorder specialist who has experience using this treatment.
Fantastic. Okay. Thank you both very much. Have a wonderful day.
Thank you.
Thank
You
you.
too.